Every teen goes through some periods of unhappiness, but with the rising concern of teen suicide rates, parents and educators are more concerned about early warning signs and intervention. Dr. Rachel Hailey of HCA Midwest Health stopped by to discuss what we need to know and what we can do about it. As a family practitioner and a family doctor, what are your thoughts when you see more and more stories come out about teen suicides and the rates seeming to climb?
Well, teen suicide is becoming a national issue, and it concerns me not only as a physician, but a mom of 3 young adults.
Yeah.
The number of teens committing suicide is growing at an alarming rate. In fact, the rate of teens actually committing suicide from the ages of 15 to 24 has tripled in the past 50 years. And, this is due in large part to the increasing amount of depression that we're seeing. There's another study that shows that just between 2009 and 2017, the rate of depression in kids from the ages of 14 to 17 has increased 60%.
Oh my.
And with school right around the corner, we need to be alert and involved in our teens and young adults' lives and looking for changes that can cause, problems with mood and behavior.
Are there specific examples that we should be looking for with our teen or our young adult? Maybe some warning signs that can give us a glimpse maybe of something bad to come?
Yes, our teens are facing incredible challenges these days. It's, they're dealing with body images and academic expectations, competitive sports, bullying, and peer pressure. And it can be difficult to differentiate and tell the difference between the normal ups and downs that, just being a teenager has versus depression. However, a teen who is really suffering from depression will often show things like a lack of motivation, changes in friend groups, risky behaviors, driving under the influence, shoplifting. They may come home from school, close the door, and stay in their room for hours. Some other signs are anxiety, even physical complaints, low back pain, headaches, stomach aches, fatigue. They may have inappropriate guilt, appetite changes. They may, have a loss of appetite or compulsive eating that leads to rapid changes in weight, either weight gain or weight loss.
What should we do to help them out? Like, what's a good path to try to get them put back on?
Talk to them and be open. There's so much stigma about mental health, and we need to just let them know that feeling down is not a weakness. The strength is being open about our struggles and accepting the support. If your kid's unhappiness seems to be lasting more than a few weeks, that's time to get a health professional involved. You can contact your family doctor or your pediatrician, and that can be your first step in looking for the early interventions that can help them, like a referral to a mental health professional or even medication. I'm really pleased that our HCA has a new program that's dedicated to the treatment of these teens. I mean, these teens' brains work differently. They need more than what adults do. They have to have specialized training in dealing with them, and that program actually involves the teens, the parents, the teachers, the counselors, so they can get involved ahead of time and prevent that rapid cycle of depression that can lead to teen suicide.
It's scary, but I mean, I think that conversation that you have with them, despite how awkward it could be approaching it, I would more than rather have that awkward conversation rather than the alternative.
Yes, absolutely. Be open, talk to them, let them know that, mental health is not a bad thing, and get them the help when they need it.
For more information or mental health referrals and to find a teen program near you, visit researchpsychiatriccenter.com.